Hi everybody, so today we're going to talk about knee injuries in general. Now, there's a lot that can go on in the knee. There are ligaments that need to stabilize it. There are the muscles and tendons around it that are responsible for its actions. There's the bones themselves, the cartilage that supports it, and of course the meniscus that is the ever-present fear for everybody. And what I want to talk about today is not necessarily how to self-diagnose, because of all the complexities within the knee, there's a lot of different things that we're going to look at in clinic, both in a physician's office through radiology and in our tests for functionality, for what might be some things that could be going on there. What's important to know is when you do have an injury, what should you be doing about it? So, one of the big things that I always am concerned with is, has somebody been continuing to move their knee? We've kind of addressed the old Rice method in the past, which was always you should rest the injured limb, you should ice it, compress it, and elevate it. And that has been changed over time because as we've learned more and more and more about how the body functions, we've learned that it might not always be the best way to address an injury. The big thing that we're encouraging right now is a new acronym that we call POLICE. The P is for positioning. Everybody has a little bit different way that they find an injury tends to be its most comfortable. A lot of people find that full extension or full flexion of the knee is actually more painful, and having a little bit of a soft bit of flexion in there can actually be a little bit more comfortable. And that comfortable position can be very important for when we have to have a sustained amount of time. However, the O and L are combined into what we call optimal loading. Instead of absolutely resting your injured limb, what we encourage people to do is have a little bit of slight activity. That movement can be very important because absolute rest can still allow a lot of swelling to accumulate. And while swelling is an important part of the healing process, allowing it to accumulate for too long can actually have a little bit of a damaging effect as well. So absolute rest is not something that we generally encourage outside some very specific diagnoses anymore. And what we tell people is when you're trying to do that guarded phase until you find out what's actually going on, we tend to actually encourage that optimal loading period. For example, on a knee, using a cane or a crutch or a walker in order to offload the affected side. So I'm actually going to put my crutch opposite my injured knee so that as I step forward with it, I can lean away from the injured side. That type of optimal loading can allow you to continue using your limb almost as normally as possible without necessarily putting as much pressure through it that is aggravating. Now, if your knee is completely unable to accept loading, the optimal level of load for you will be pretty much nothing until you get to the doctor and find out more. And that is okay as well. So, you have the P-O-L. I still stands for ice. During the early phases, you do want to make sure that the inflammation is relatively well controlled. Having no inflammation isn't necessarily necessary, but you do want to make sure that that's still there. The C and E are still compression and elevation. When you are able to rest it, trying to keep it above heart level and keep a little bit of light compression using either an ACE bandage or something light like the standard sleeves that we're using, made of similar spandex type materials to Under Armour. That light compression can keep swelling from getting too bad, allowing the blood to keep moving through there and allow the important nutrients to keep going in. Now, because knee injuries are so hard to self-diagnose, it can even be hard for us on the field. So PTs and athletic trainers who tend to travel with sports teams can actually have a hard time making an absolute diagnosis on field after an injury, because the initial guarding and the initial edema can prevent us from doing some of the stability tests that might have shown us something in the future. But some ways you can kind of tell what might be going on for yourself. Immediate instability in the knee, meaning that as you take a step it feels wiggly, wobbly, that might be an indication that you may have a ligamentous sprain, strain, or injury. If you have difficulty with active contraction of a muscle, that's usually a very good indication that there may be a muscle injury involved. If you're having issues pivoting directly over one direction, you feel a catch in your knee, that would be more of our indication that something could be meniscal, as opposed to just having a general inability to weight bear after especially a more compressive load like a direct injury like a car accident might indicate bone issue. However, we're generally going to make sure we do a very full and thorough exam. So this is not usually an area that I tell people definitely a good place to self-diagnose. If you're not sure what's going on, especially if you had a relatively severe fall or a twisting where you felt something completely wrong, it's always okay to get into a doctor. But what I tell people is make sure that in the meantime, until you can get that appointment, you're taking good care of it with that POLICE method. All right? If you have any other questions for us about any of these injuries, please let us know. Have a great day.